Hello everyone, I'm Dr. Ishita Barua. I'm going to tell you a story. I've called it How AI Became the Doctor and How the Doctor Became the Patient. It's a personal story of mine. Now, a couple of years back, I worked at a hospital. I was doing colonoscopies, colorectal cancer screenings through colonoscopy. And during my training, I used to have a supervisor, a more experienced colleague that would stand beside me and really learn me and teach me the ins and outs of colonoscopy training. Now, the thing about colonoscopy training is you have to be really thorough when you do an examination of the colon. You're looking for precancerous lesions and even cancerous lesions. That can be hard to do. You have to be laser focused. You have to have maybe a sip of coffee, slept enough, really being able to perform at your very best. Now, I felt scared when I was done with my training and going to be doing these examinations independently. And I thought to myself, this really needs to be, I really need to focus. What will happen if I miss a polyp, a lesion, and then 10, 15 years from that point, the patient develops the cancer? Then that's on me. And during that time, I really thought a lot about a previous time from when I was doing a lot of gaming, Super Mario on Nintendo. And I realized what I really needed was a functionality called assist mode. You have that when you do a lot of gaming. You have the functionality of actually getting assistance. So maybe you're playing Super Mario and you're going to catch all these gold coins, running off, maybe falling off a cliff, but then you will get assisted, making sure that you're on the right track. Now that's what I needed as a doctor. I needed an assist mode. Why would we have that for gaming and not for doctors in the hospitals? So when that occurred to me, I went looking for research projects that were utilizing technology as a means of actually becoming a better doctor myself. How could I implement technology in a way where it supported my examinations and patient care? And I looked to artificial intelligence. I found a research group that were looking into this, and I joined. Now, fast forward a couple of years. I had completed my PhD. I was done with my training. I found that AI could actually enhance and actually be implemented in a way that it could improve patient care. However, there were still many things to be discovered. How could we implement it in a way that ensured that it was done in a fair and equitable way? Now, a group of Norwegian AI experts were invited to a country abroad to learn from how they had implemented AI at their hospitals. They had done it successfully and we wanted to learn. During one of those visits, we came across a startup that were developing an AI tool for eye conditions. They were doing screening of 3 different types of eye conditions. And when they wanted to demo this AI tool, they asked for one volunteer from the audience, just like you. And I looked around. I thought, well, I'm probably the youngest one here. All of these eye conditions are all age-related. I'm probably safe. I'll volunteer. So I did that. I volunteered. And then when they screened my eyes for the first and second condition, I tested negative. I didn't have them. Then for the third one, it came back positive. And it was disclosed to the whole audience. So at that point, I realized I had given them my consent and said that I wanted to volunteer, but I did not consent to that being broadcasted. So standing there getting this diagnosis, I was afraid. I had all these questions. Obviously, they didn't know that I was a doctor myself, so they couldn't know. And they didn't give me any more information. They just said, oh, you have glaucoma. And then I stood there. Because I was a doctor, I knew, okay, if this goes untreated, it could impair my eyesight. My vision could get blurry. That made me afraid. And so I asked them, well, what does this mean? is there already findings that would indicate that this is a problem? Do I need medication right now? They just simply told me, we don't know. Next. So there I was, getting a diagnosis from a machine, basically, and the startup staff wasn't able to really provide me with any more information. I was scared, as anyone would be in that situation. Now, after that experience, I went home. And of course, I met with an eye specialist or ophthalmologist, and I had her examine my eyes. And I didn't tell her about the AI diagnosis at first. I wanted her to examine me without having the bias. Then she told me, your eyes are fine. There are no conditions. You have no diseases. It looks very good. Then I told her, okay, but I had this AI screening done, and he told me that I had findings that could represent glaucoma. Could you see any sorts of findings that would indicate that? And she told me, well, I will have a second look, but I didn't find anything first time around. Then she did a new examination. She looked at the retinal images. Then she told me, well, actually, nobody likes to hear those words. Well, actually. And then she said, you have something. It's a benign condition. It's called myelinated retinal nerve fibers. It's something different from glaucoma, but for the untrained eye, pun intended, it could look the same, especially on images. Now, I thought to myself, is this common? So I asked her, how common is this? Then she told me, well, it's pretty rare. Less than 1% of the world's population has this. Now imagine, I had something that rare. Now I've always known that I was a minority. I know that I have dark skin. What I didn't know was that I was a double minority because of my eyes. So the thing is, prior to going to the ophthalmologist, I thought, what are the chances for this being a false positive? None, I thought. Because the startup had already bragged about how the accuracy was so high, at least more than 90%. So I couldn't really find comfort in that. And now she found something else. It was a false positive, indeed. So even though you have a really high accuracy level, it can still go wrong. And it took a domain expert to be able to tell the difference between two conditions. Now, I wanted to correct this. I wanted the next in line to be able to get a right diagnosis. So I asked for the retinal images. Could I have them, please? Then she told me, well, you can have a black and white printout. And then I told her, well, it's not going to be good enough. The quality is not good enough. Can't you send it to my email? Well, no, it's not going to be privacy compliant. You can only get a printout. That's really bad, because then I could not go back to the startup and ask them to diversify their data sets in order for the AI model to train on rare conditions like the one I had, so the precision could get even better. Okay. Now, the reason why I'm telling you this story is because there are 3 points I would like to highlight. First off, we really need to be careful in how we design these AI tools. They really need to take into account that these are AI tools that are going to be implemented in healthcare, for instance. It needs to be designed in a way that is attentive and really empathetic towards the patients. Now, this wasn't a fault on the AI tool's end. It was the way it was supported by the people behind it, the ones that developed this and utilized it on me. They didn't think about the fact that I was going to get a diagnosis, and in that moment, I became a patient. So where's the patient care in just handing out a diagnosis and not really providing the care that is needed to go forward? That's one thing. We really need to be mindful about how we design the process of actually utilizing this technology. It's not just the AI tool itself. It's how you use it and what you want to achieve by using it. Now, the second thing, you've probably guessed it, is the fact that we need to have diverse data sets. They need to represent the population that it's going to be used on. How do you get that? There are two points or two ways to do that. One of them is by having the developers really acknowledge the data gaps. Which groups are not or is underrepresented in these data sets? Which individuals are lacking for this model to actually give a fair and equitable recommendation? That's one. The second way is for the patients or the individuals to actually own their own data. In my case, I wasn't allowed, or the only thing I could get was a snapshot of the screen, the doctor's screen. It still wasn't good enough because I couldn't really go back to the startup and ask them to diversify their data set, so they couldn't really use it. Now, I think if minorities and all individuals get to actually own their own data, they can decide for themselves who will have access to your data. Then you can also donate your data. You can share it for research purposes. You're able to own it, then you can share. So there are two ways, I think. These are the two. How to mitigate having data sets that are not reflective of the population it's going to be used on. Now, the third thing I want to highlight from my story is the fact that I had a very supportive doctor, the ophthalmologist, that was able to correct the misdiagnosis. Now, she was confident enough on her own abilities to disagree with the AI tool. Now, let's say the development that is occurring now keeps up. The AI tools are performing better. The miss rates of these AI tools are going down. The human error rate is relatively like it's standing still. What do we do then? Who will be the expert? Who will be the second opinion? Can we still allow for humans to be the second opinion if the error rate of machines are lower than the ones of humans? So the thing is, we really need to be able to support our physicians. If they're going to be the ones who are serving as human in the loop, they need to be able to be confident. They need to be able to disagree with these AI tools, even if they're wrong. They cannot fear lawsuits and then be influenced by that, the fear of having lawsuits brought upon them. We need them to keep their integrity so they're able to perform at their very best. And this is something we should look further into. How can we support that? Well, we need transparency in these AI model developments. How do we develop these AI models? What data sets are there? So transparency is really key. But also, we need to educate everyone. In this case, healthcare professionals. So they are aware of the pitfalls of AI tools. So they need this support so that they can still be confident in their own diagnosis and their own judgment. So the moral of the story is really, we still need humans. I made a career out of looking into how AI can be leveraged in healthcare, but I still believe that there is a place for us humans and domain experts. But I think if we can sort it out, how do we make sure that AI actually improves our lives? I think it can really revolutionize healthcare and how we conduct patient care. So there needs to be a balance between technological advancements and patient-centered care. Thank you.